Hi y'all, I'm Dr. Melissa, and usually I'm in the kitchen cooking and talking about food, but today is very special because I'm going to share my personal story on why I got into this space of healing through lifestyle. It was actually me who had IBS. I remember as early as in my teenage years where I had excess bloating, I had gas, I had flatulence, I had loose stools, and this was something that would go on not just once, but for a couple times a week, and sometimes even more into months. And I didn't realize that this was my number one sign for stress and anxiety. And interestingly enough is that 20% of our population has some form of anxiety. Anxiety can be overwhelming, and it can be something that people face just on a stressful occasion or throughout their day and lifetime. However, when I was a teenager, I had no idea what this was. I remember getting nervous, sweaty hands. Sometimes it was simply because I was excited because my friends were coming over or I was going to go to a party. I didn't realize at that time I was just overwhelmed because of either the stimulus in my head or around me. I was overthinking it, thinking I was going to be a failure if I was doing homework or if I was going to have a test, and I was confused. I didn't know what to do. I didn't tell my parents. I kind of hid it. I consumed all my nervousness. I just kept eating it, and it was actually eating me alive because not only did I have trouble concentrating at times or getting frustrated with my symptoms, it just kept going on for years and years. And then later on, I remember I also had reflux. That reflux was something that came on after spicy food, saturated food. I love my Filipino food, but also American food. I love competing with my fellow classmates, and literally they were football players and basketball players. I was a cheerleader, and I was grabbing, trying to have eating contests because I thought I could eat so much, which I could, but it also gave me so much pain and indigestion to the point where I felt that reflux, I felt nauseous, and it was very uncomfortable. And again, I was a teenager in high school, and I even remember in junior high having these symptoms. Most of the time at that age, we just keep going, we have fun, and we don't recognize it until maybe our 20s, 30s, and sometimes later on. In my 20s, I was still eating very poorly, lots of junk food. I was the hot Cheetos girl. Cup of noodles was my jam. And then I just ate it and ate. I thought if I ate more, I would feel better. I also thought if I had some other types of food like sodas and juices, that would calm it down. Unfortunately, it made it worse. I know if that's you, you probably can relate. A lot of my patients relate, and they recall the times it was just burning them up inside. I not only had reflux, but I also had acne. This acne would not go away. It was very stubborn. It was the point where it was not only all over my face, and it didn't matter what I had that day or how stressed I was, because I tried my best to actually minimize some of the spicy foods and the salty foods and the chocolates. It was just so confusing. I was overwhelmed. I tried so many versions of Retin-A, topical clindamycin. I was given doxycycline oral. I was also given and offered Accutane. And from then on, I realized that was not something I wanted to try. There's just too many side effects, and I was overwhelmed. In my IBS, I was offered tons of different options. One of them was dicyclomine, and that was a popular one. It was meant to relax and avoid the spasms in my stomach, which I would have. I literally remember crawling and not being able to do what I need to do, bowing over in pain, gassed up for literally hours, and tried all the water, you would say hot water and heating pads. I tried Pepcid, Tums, was offered omeprazole and PPIs, and when I heard the word dicloxamine, I looked up. I was in medical school. I was struggling because I was just frustrated because I was in so much pain, and it was hard for me to focus and study and do well, and I just felt like I was going down this spiral. Literally, I felt depressed and anxious, and I didn't even think I would get through. It was a really hard time for me. It was tough. I literally had to pause because my primary care doctor at that time was offering this to me, and I was studying these medications, looking this up, and I didn't even really understand IBS. I knew it was something that I heard of. I didn't know it was lifestyle related. I didn't know it was probably due to my stress. But I was like, okay, let's see. And I looked at the side effects, and literally the first thing I saw was nausea. That scared me because I didn't want to feel nauseous. I looked at the percentage and it said 14% of people are likely to have some type of nausea, and I didn't want that to happen. I thought that was just going to make me worse because when I get bloated or have reflux, I feel nauseous anyways. And then about 33% of the people had dry eyes, and I definitely didn't want dry eyes. I was thinking, oh my goodness, how can I even study and focus? And then I looked up some of the other symptoms, and that was dizziness, 40%. And I was thinking, here I go again. Am I just going to get worse? Is this going to be another symptom that I have to deal with? How can I even get through med school? How can I get to a better place? I was overwhelmed again because 27%, I looked it up, possibly could get blurry vision. So I knew not only this was not the medication for me, but there had to be something weird about this medication because it not only affected the gut, but the brain because of the dizziness, the eyes, and I wanted to find out, well, then what's the cause? Why is this happening? So I had to do a deep dive. I remember at that time, I just gained so much weight, literally 20 pounds more than I wanted. This is the first time in my life I was used to being really fit and thin and someone who was actually proud of the aspect of being active and able to be comfortable. At that time, I was hiding in all this junk food, frozen food, going into just food runs and having a lot of shame. And I was like, what am I going to wear? Loose clothes. Anyways, that summer, I decided I would try to only eat oatmeal. That was hard. I felt like I was fasting. I ran every day. I exercised. And yeah, that helped tremendously. I got more fiber. I lost my weight. I started running 5Ks, 10Ks, half marathons, and I felt much, much better. My reflux started to improve. My acne improved. But really, when I went fully plant-based, and this was during residency at Loma Linda University, and I didn't even know that that was one of the blue zones. And during that time, I saw how people were thriving. Some of my patients were really sick, but the other piece of that story was I saw centennials for the very first time. These people lived to about 100 years old. These people had really minimal medications or none. They didn't have any hypertension, diabetes, heart disease, and they were thriving. Some of them were more active than me. I remember one of my spin instructors at the time was a 7-year-old recovering from, I think it was a parotid cancer. And I was just so inspired. I was going to spin and exercise again. But also I went to a lot of conferences. One of them was ACLM, a lifestyle medicine conferences. I read books on forks over knives, how not to diet. I looked at the research, Adventist studies, nurse health studies. And then I saw fiber was not just a powder form or a pill, but it was from plants, fruits, vegetables, beans, nuts, and seeds, things I've heard of. And I do enjoy. I actually gravitate to a lot of vegetables, fruits, not so much. And I do love my seeds. And then mung bean, that's in some Filipino dishes. So I was used to it, but I never knew that's something you had to eat every day, and even knew that's something that can be all of your diet. So I was so surprised. I gave up all that meat because I knew that was something I just needed to try. The pork, the bacon, the cheese, also the chicken, all that, and felt so much better for the first time. I got rid of things in my kitchen, specifically did a pantry clean out and a fridge clean out, and I cooked for the first time new dishes that were more plant-based. They actually were flavorful. I changed up all the ingredients, swapped them out from my old recipes, my traditional dishes, but also learned some of my favorites, which were really simple. It was like tofu, miso soup, bok choy, also was chickpeas at the time, and some bean stew. I made some wraps, and it really was very tolerable and delicious. I thought it had to be lettuce every day, but I got creative and tried different types of foods. I even made some nice desserts that were full of fruits, and I got to explore pumpkin seeds for the first time and chia seeds. I never even heard of these things. And flax seeds, some of the words I couldn't even pronounce because it was so new to me. I later on discovered not only did my IBS calm down for the first time, I didn't have the bloating after every meal, I didn't have to run to the bathroom, I didn't have to go out and about and prepare my meds because I actually had the freedom from food. I remember at times I didn't even get to socialize and go out with my friends because I was scared that I would just feel worse and I couldn't handle the foods that they would serve, or even the alcohol that would make me even worse. So I cut down all the animal products and I felt so much better. My IBS went away, my reflux literally cleared up, and so did my acne. And that was the beginning. That was the turning point for me. I said to myself, I have to practice this way for every patient. I have to give them this opportunity to show them the truth that food is medicine. I wanted them to know, yes, exercise is key, and movement and managing your stress, breathing through those moments of anxiety, but also food is the foundation. And I wanted to share that. And that's why I created a lifestyle medicine practice called Dr. Lifestyle. I went into other fellowships, not just lifestyle medicine at Loma Linda, primary care psychiatry, integrative psychiatry, and now my integrative fellowship. Literally, I've taken so many even functional medicine courses. I've invested in myself and my health because I wanted to try it for me and my patients, and I saw the results. My patients got so much better from their GERD, their IBS. I saw them improve in their acne, type 2 diabetes, their hormone issues, their thyroid issues, even their menopause issues, and it's been so rewarding for them and me to live this journey. And that's why I created Dr. Melissa's Kitchen, and I can't imagine myself doing anything. So if you ever want to hear more about the science behind this, but also food, healthy recipes on good mood food, gut health, and even all things health, immune health, I'm here for you. Follow me at Dr. Melissa's Kitchen, like, subscribe, tell a friend, and I'm so glad you're here with me.